what my cancer treatment was actually like. Part 1. First, let's talk about chemotherapy. It actually isn't always the first step in someone's cancer journey, but it's one that people often think and ask about. So I'll start here. Chemotherapy is a type of cancer treatment that uses powerful medications to destroy fast-growing cancer cells and prevent them from spreading. Unfortunately, almost every patient experiences at least one side effect. And for me, my main side effects I dealt with included significant weakness and fatigue, nausea and therefore difficulty eating normally, gastrointestinal issues like diarrhea, and then muscle pains as well as bone pains, both from the chemotherapy agents themselves and also from another agent given to stimulate the bone marrow to produce new blood cells to protect my immune system during treatment. Many patients are also given hefty doses of corticosteroids, such as dexamethasone in my case, to help prevent adverse reactions to some of the agents. There are many different chemotherapy regimens, some of which include immunotherapy as well at the same time. But in general, you go to an infusion center, have labs drawn, see your doctor, and then you'll spend all day having the various medications infused through an IV, or ideally a chemo port, which is a lot more comfortable and easier to deal with. I'll make another video specifically about chemo ports soon. Some regimens have you go multiple days in a row, then take a few weeks off to recover. Some regimens, you just go one day at a time, separated by a week or two. It varies per regimen. For me, I went 3 days in a row. Usually the first day took about 12 hours or so, and the other 2 days took like 4 to 6 hours depending. Day 4, I would take some medications at home, and then days 6 and 7 were the worst in terms of the chemo crash, which is when the fatigue, nausea, and some other side effects start to really kick in. In total, each cycle was 3 weeks for me, and I did 4 cycles in total. Please consider liking, commenting, and following if you like this video. Feel free to share your experience, especially if it differed from mine. I know the regimens can vary quite a lot, and let me know what else you might be interested in hearing about. Thank you all so much for your support, and I'll talk to you soon.